I'm going to talk on basics. You have given me basics of modes of mechanical ventilations, basic modes, but I have omitted that basic purposefully because it's all depends on the ventilator what you are using. There are many modes which are coming up with the new ventilator. Actually, whether they are advanced or not yet proved with the recent studies. So I'll go through quickly about all those modes. Why do you need mechanical ventilations? You are just pushing a mixture of air plus gases, which is normally oxygen, into the lung via an endotracheal tube or tracheostomy tube. Then we call it mechanical ventilation. We all know that when you have a problem with the patients, we need to ventilate them, and also we have to consider many things while you are doing ventilations. Of course, the selection of mode of ventilation is very important, but I have seen that there are some institutions they do use one kind of modes frequently than other kinds. So it all depends on is clinical familiarity or also institutional preferences. And we this is mainly because of that we don't have any enough evidence to suggest that one mode is better than other mode so far. So you can see this graph slide that basically we have a controlled mode of ventilation type which can be again volume dependent or volume limited or pressure limited. And assist control mode, another control mode, which is I'll explain what is the difference.